Now, 5 biopsies, 5, failed to detect Jeffery Barkley's prostate cancer, but a new diagnostic test finally found it. Dr. Richard O'Neill explains how these new tests are saving lives, lives like Barkley's.
This bear was shot in New Brunswick, Canada. It was shot with a rifle.
How big a rifle do you need to shoot a bear?
Any size rifle that you'd use to deer hunt with will adequately shoot a bear.
Is there a particular place you have to shoot it?
The best place is just like on any big game animal, through the vitals, try to double lung shoot them. Approximately 10 years ago, I was going for my annual checkup, and my doctor noticed that my PSA levels were slightly increased, and it created a concern for him. I didn't know much about it at the time, and so every year we noticed that it increased noticeably. I had slight trouble with urination. My sexual life wasn't what it had been before, and I sort of wrote it off to, I'm getting old, everything's wearing out, nothing's working. And I just had a concern, but yet I knew there was something physically wrong with me. I could feel it. When it hit the index mark of 4, he suggested that I go and have a biopsy done. And each time I went for a biopsy, I was sure that they were going to come back and tell me, yes, you have cancer. And I was prepared myself to deal with that. And so it was really no surprise when Dr. Vourganti sat me down and said, yes, we found cancer.
What was it like for you getting the diagnosis?
My wife and family members were shocked. They were upset. They were scared. But I think I was already prepped for that.
So Debbie, what was that like for you?
That's when it actually hit me, and I mean, just the way that it would in anybody, the door just closed in my face.
The vast majority of us men will develop prostate cancer if we live long enough, but it would never kill us. The word cancer, though, scares us into a lot of medical procedures that might very well leave us incontinent or impotent or both. Let's go talk to a medical professional about a possible new treatment option that might help.
The problem with biopsy is you put needles in the prostate and you're essentially doing a sampling. As biopsy is done without these new technologic refinements, you literally are just going to areas that tend to harbor prostate cancer. You aren't going to anywhere particularly suspicious or not. And what people have developed, and some have even gone as far as to call it a manogram, where you take a picture instead of just having this vague suspicion or risk category, or we have your PSA test. And so imagine a world where a woman would come to the doctor, get a blood test, and we're doing your breast-specific antigen test, and it's elevated, and we think that you have a 30 or 40% chance of having cancer. So now we're going to put needles in, we're going to put 12 needles around the clock face of the breast. We're going to pull them out and tell you if we found something. So what we do now is we perform these pictures ahead of time with MRI, and we find areas of suspicion and come up with targets. And we use refinements in technique with our biopsy technology and computing and the concepts behind GPS and 3D spatial accuracy, and we put the needle right in the spot.
It used to be a death sentence, a cancer. You hear the word cancer, and people thought, oh no, they're going to die. And it's not true nowadays. A lot of cancer can be treated. A lot of cancer can be dealt with, and you can even live with cancer for quite some time. And I can't stress to everybody, especially the fellows that I'm talking to now, I tell them over and over, involve your wife, your girlfriend, your spouse, your family with it. Talk to them, get them involved, get them educated to it, because that support has been tremendous. My wife has been by me through this thing, thick and thin, and I would have had a difficult time doing it without her.
I love him for him. It doesn't matter. I love him with my heart.
Prostate cancer rates second only to skin cancer as the most diagnosed cancers found in men.